Okay, so good afternoon, Dr. Pasha Paul. This is Ms. Reed, the Food and Agricultural Food representation here in Trinidad and Tobago and for Suriname as well. We have some questions here, primarily on the region, on food security, and also on gender. So, within the CARICOM member states, due to liberalization of trade, we have some challenges with regard to food security, public health, and nutrition. What are the effects of these challenges on gender?
Okay, first of all, let's look at what those challenges are.
Yes.
Because of trade liberalization, what has happened is some of the key pillars of agriculture are no longer there: bananas, sugar. And that has impacted on the whole agriculture sector. There are no subsidies as well under the WTO. And so it means that in terms of importation of food or even local production of food, the patterns have changed. Importation, you're getting a lot of these processed carbohydrates coming in, and that has impacted on obesity. So in terms of gender and the obesity issue, we find that a number of Caribbean women are much more obese than men. In fact, the statistics I have available is showing that statistics are showing, for example, in Barbados, you have 50% obesity in over 30 years old in women as opposed to 23% in men. In Trinidad and Tobago, 55% obesity in women as opposed to 16% in men. In Dominica, 54% as opposed to 27%. And in all the cases, the incidence of obesity in females is higher than in males. Now, the impact of the whole issue of nutrition is that the women in the household are mainly the ones who are responsible for buying the food. Okay, so if the food prices have changed, well, first of all, they will of course be looking at the foods which are cheaper. The foods which are cheaper are not necessarily the ones which are most nutritious. So that the whole impact on gender there is that it will have an effect on the food that is being fed to the family. And of course, there's also an impact not only on the family, but even the women themselves. If there's less availability of nutritious foods, it impacts on the women's health, especially if they're pregnant, so there's maternal and child care that's where. And children who, for example, are products of lactating mothers who are undernourished will have problems with terms of learning abilities, education in school, etc. So there are nutritional impacts because of the food that we eat, both in terms of obesity, overnutrition in certain foods, and undernourishment, malnourishment. And the impact on gender is that, of course, the women are the ones who are, for example, buying the food or eating the food or even determining what is fed to the family, and so the impacts are nutritional standards there.
Okay, so it's mainly a negative impacts that are coming down.
A lot of it. It's showing negatively. Yes, because the food import bill has gone up.
Yes.
And so even to eat healthily now, you find that it's expensive to eat healthy unless you have food in your backyard. And that, the effect of gender there is that a lot of the women in the households are the ones who are responsible for the home garden, for example. So that could have an impact positively, because then if the women of the household decide to grow a vegetable garden, etc., because of the impact of the high prices and so, it will have a positive impact because the food that is being used in the household will be healthier. But that depends on the nutritional, the level of education of the woman in terms of her knowledge of what is good nutrition, what are healthy eating habits, etc.
Yes. So, what do you see as the main challenges in developing a food security policy at the national level?
Well, there are many challenges because you have to look at it in terms of what is food security policy about. So you're talking about, first of all, challenges with respect to the people who are making the policy, the decision makers, the policy makers, the ministers, the buy-in from them in terms of whether they think it's important. Because in some countries, health and education take precedence over food security. So even to allocate resources for food and nutrition security is an issue. The second issue is who is involved in making this policy. Sometimes the very people who are impacted, the women, the vulnerable, the children, the poor, these are not the people who are at the table making the policy. So the lack of inclusion is another big issue. Another key issue that we have in the Caribbean is lack of data for decision making, and the data that you need to make the proper policies are not available. So that's another key issue. And a number of times when we're developing these policies, we see food and nutrition security policy as strictly from the point of view of food production. So it will be the ambit of the Ministry of Agriculture, for example. But food and nutrition security involves the Ministry of Health, because you're talking about nutritional issues. You're talking about environment, because the way you grow the food, you have to do it in a sustainable manner. You're talking about education, if you're talking about the impact on young people, community development, and all these ministries have to be at the table. You're also including your academia, your research institutions, your civil society, and sometimes the challenge is to get all of these people to sit together because we operate in silos in the Caribbean. So those are some of the issues that are involved here. The fact that it is the buy-in is not there, the decision makers don't have reliable data, the inclusion, acting in silos, and sometimes the resources that are necessary for implementation as well.
So one key things would be to build and maintain our partnerships.
Absolutely, partnerships are key.
Yeah.
Absolutely.
Sounds good. And what are these national food security challenges? How do they impact on gender?
Okay, let's look at food security. Food security has a number of pillars.
Yeah.
There's availability, which is the production of the food. So the impact of gender there would be in terms of what are the inputs that are required for production. Your land, your access to land. In a number of cases, the women do not have access to title of land.
Okay.
Invariably, in some cases, it's the husband who has the title to the land. And so that impacts on the ability to get a loan or credit. Even education, extension, access to extension and to education and how to grow the crops properly, etc. Gender has an impact there. Another important part of that is access. Food security is access to food, the markets that the food, and even the money that you have available to purchase these food items. If you have single-headed households, for example, invariably most of the poverty-related, most of the households which are very poor, are headed by single women.
Okay.
So the gender impacts are there as well. Even with respect to your availability, the production technologies, women are involved in certain aspects of the production technology. In other words, there may be hazards associated with the types of roles that women undertake in production. If, for example, they are involved in using pesticides, there may be hazards associated with that. If they're involved in agro-processing, the handling of the food safety aspects of it. Nutrition utilization is another pillar of food and nutrition security. So that, and women are made, they consider the gatekeepers of the household in terms of nutrition. The types of food that are consumed by the household is usually, they're usually determined by the woman of the household. The purchasing power of the woman is important. Even with respect to stability, which is another pillar of food and nutrition security. Stability has to do with the part of the definition of food security, which talks about having food at all times, even in times of drought, in times of hurricanes, in times of high food prices. So in times of high food prices, as I said earlier on, sometimes the woman is the one who is responsible for purchasing the food. So there are gender roles associated with who has the purchasing power, and that could impact on the amount of food that is purchased, the quality of food that is purchased. Sometimes even the women, I know in long ago, I don't know what it obtains today, but the woman used to make sure that the husband and the children, or the husband had the best of the food, you know, they got the bigger part of the chicken, etc. And then whatever remained was for the children. That impacts on the nutritional status and the food security that is involved as well. And even in times of the impacts of hurricanes and droughts, if you have households which are more vulnerable, and some of these more vulnerable households are the poor households, and these are the households headed by females. Sometimes females have multiple roles that they play. They have to take care of the sick, they have to take care of their older parents, etc. And so that takes away from the time that they have if they are, for example, involved in tending their gardens,
Yeah.
It takes away from the time that they have for production purposes, and so that would impact on the nutritional status and the food and nutrition security policies at the national level.
And what steps have been taken to mainstream gender within the Food Security Action Plan at the national level within Caribbean territories?
Well, gender mainstreaming has been done through a number of areas. One is linkages with gender policy and food and nutrition security policy, because in a number of countries they do have a gender policy. So we look at trying to harmonize throughout to make sure that the gender component is taken into consideration. There's also the need for involvement of the gender groups, your women's groups, and all people who are involved in work with women, with boys, with young girls. Anybody who is likely to be impacted will be involved in the decision-making process, in the policy-making process. There's a lot of stakeholder consultation which goes into producing and formulating a policy and action plan. So by including these people who are these stakeholders who are affected and impacted in the process, then they have a say, and so their voice is heard, and so their concerns are included in policy. There's also a lot of gender analysis which goes on, which, as I indicated before, depends on the data that you have available, and that's why it's so important to have gender disaggregated data. So gender analysis is another important way of mainstreaming gender into the policies that we use.
Okay, so we need to hear from the persons that we are making these policies for.
Yes. The people who are most impacted, and it's gender, it's the boys and girls. Yes. For example, right now you have the boys who are dropping out of school. How can we get them engaged in agriculture or in food security? And what are the impacts of all of this, the fact that the boys are dropping out of school, the girls are getting higher education? How will that impact on your nutritional status? We need to bring them to the table to get their views so that when they develop the policy and the action plans, these concerns are addressed.
And the Regional Food and Nutrition Security Policy, it has outlined a number of benefits that can be better accessed at the national level through a regional approach to food and security. So which of these have been implemented in any of the regional territories?
Okay, the main aspects of the Regional Food and Nutrition Security Policy which are implemented at national level would be things like resource mobilization. Because in a lot of cases, some of these donors prefer to deal with the region as a whole as opposed to nationals. So if, for example, we get a regional project, and FAO has done a lot of we're doing a lot of regional projects which impact on food and nutrition security. There's the Zero Hunger Challenge, there was the food and nutrition security, there was the regional food security, what is the name of that? I can't remember it now. The regional, it will come to me. Anyway, there are a number of regional projects which are currently being implemented by FAO. There's a youth project that is going on that we've just received $1.8 million for, and so we get the funding regionally, but the projects are implemented nationally, so they benefit from it. Another area where they benefit is through capacity building, because there are common needs in the countries, and so when we roll out these capacity building programs and these training programs, we have regional workshops where all will be involved. Another area is through the promotion of partnerships, bringing various partners together, be it the donor community, be it our regional institutions, partnerships with other extra-regional agencies and countries through South-South cooperation. For example, there's a lot of funding going on with FAO projects from the Brazilian Corporation, so that we can use this funding for the benefit of at the national level, but it's regional level through regional cooperation that we're able to implement at the national level. Another area is through harmonization of legislation. By looking at in various countries the legislation with relation to food and nutrition security, or with respect to disaster, for example, with respect to plant quarantine or protocols for trade of seeds or trade of commodities in the region, by harmonizing the legislation, which would allow greater trade, we do it at a regional level, and the countries can benefit at the national level. And also in terms of promoting clusters of farmers, for example, it is envisaged that, for example, you may have a group of farmers in one country who are producing a particular commodity, but there may be other farmers from other countries who can consolidate the shipment to trade to other regions or within the region itself. So in terms of facilitating that grouping, that's another way that the benefits from a regional level can redound to the national level.